From back east, rain scares people. What? Welcome to True Health Tuesday, and the truth will set you free. Okay, good. Last week we had some technical difficulties. I forgot to call the guy to film. He thought I was still in Thailand. Okay, health freedom. Those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. Benjamin Franklin. Okay, now we're going to go through, and I'm going to use all data from CDC and everything else, so this is going to be on and it'll be approved by the insane censors. But you got to get, and the toughest part is with the censorship going on nowadays, where do you get your information? And I would tell people, I say, oh man, you got to go to the sites that have been deleted. Okay, here's the sites you got to go to. Children's Health Defense.org, brilliant. And when you go there, okay, look at the data, copy the data, and share this information. The health freedom that we need to get it back. And I'm telling you, it's not just about America. This is about the world. America's 50 little individual states, okay, that have their own their own laws, okay, even though they're federal as well. But states have autonomy in a lot of different areas. The highwire.com, I mean, brilliant information. When you get on there, you can share it. Mercola, Green Medical Info. There's a lot of others out there that I didn't put in. But now, and all this stuff, if you're watching on Dr. BVIP, God bless you, thank you. Okay, being demonetized and deplatformed and everything else, okay, you guys are helping keeping this stuff going. So thank you. But you're going to be watching it uninterrupted. The second half, we're going to be talking about some unusual blood analysis that we're seeing. And Extreme Health Academy. I'm going to be doing another webinar coming up in a couple of weeks, and God bless you guys. Now, healthfreedomdefense.org. And the freedom, okay, to choose your own health care. And I like this. A foundational principle of the United States is freedom to pursue life, liberty, and happiness unencumbered by anyone or any entity as long as the pursuit doesn't harm anyone else. Are solely responsible for what you put in your body and how you choose to live. Think of this. If I was to force vitamin C on people, and vitamin C is fantastic, it's great for you, everything else, but there is a risk. If you don't drink water, if you take the wrong type of vitamin C, if you take too much vitamin C, you can get diarrhea. There's some negatives to it. But so if there's a risk-benefit ratio with everything, how could you legally or morally force this on someone? Okay, so, and I like this. It means deciding for yourself. Now, are you smart enough to decide for yourself what the risks and benefits are? And we're going to go over that because we have a couple of handouts that detail out risks and benefits that I can't show you. This is going to be on the censored portion. Okay, you guys can see it because it's your handout. Okay, yeah, so what is a risk and benefit of any medical intervention? Now, it means medical practitioners are consultants, not enforcers. And we've gone through 3 years of people losing their business, losing their job, forced medical procedures without informed consent. And we now are starting to see the damage of those forced interventions. Now, there's some historical data on here. Nuremberg trial, or Nuremberg Code, 1947, and experimenting on people without their consent is what the problem was. This was upheld also by the Declaration of Helsinki in 1964, and in 2005, the Universal Declaration of Bioethics and Human Rights. All agree that ethical medicine requires prior, voluntary, and informed consent. Informed consent. Because like if you look at our government, the government rules by consent of the governed. By consent of the governed. So if you are not going along with the insane practices of some of our governmental interventions or taking away some of your freedoms or going against the Constitution, I do not consent. Well, most folks may not realize that Big Pharma funded vigilante legislators, medical trade groups, and medical doctors believe that in this nation believe they know what's best for others and seeking to remove your freedom to choose. So we need to change this. We need to change the legislation. Now, when you look at this, where is the money coming from? What's happening? Well, 30 million a year is given to Congress, 250 million a year is lobbying Congress. Doctors are paid $3 billion a year and $3.6 billion on digital ads in 2019 alone. So this money is crazy, okay? And there's a cycle, and I like this article here, Prescription Politics. When you know that the pharmaceutical industry is, and this is the bottom line, they fund the education, okay? The government funds the pharmaceutical industry's research and development, R&D. And then the pharmaceutical industry produces the product, the government buys the product and forces the people to take the product. Now, out of this massive profits, then the pharmaceutical industry funds the campaigns for those legislatures slimy enough, to go along with this without thinking of the benefit of the people, okay? So we absolutely have to change this. Now, this is statenews.com. More than 2/3 of Congress cashed a pharma campaign check in 2020. 72 senators, 302 members, House Representatives cast a check from the pharmaceutical industry. 2/3 of Congress, okay, Pfizer PAC, Political Action Committee, contributed 228 lawmakers. Amgen's Pacific Political Action Committee donated to 218, meaning each company helped to fund nearly half the campaigns of the lawmakers on Capitol Hill. So even after years of criticism from Congress and the White House over high prices, it remains routine for elected officials who regulate the healthcare industry to accept six-figure sums. So the industry, and this is called regulatory capture, if you're producing toasters, and those toasters can be dangerous. I mean, they could fall in water, kid can stick, a fork in there, something. Okay, there's going to be an industry regulating the safety features of that toaster. Now, if the toaster manufacturer paid the regulators on the side, would you trust their judgment for toasters? Okay, there's a hell of a lot more important than toasters. U.S. tax dollars funded nearly every pharmaceutical in the last decade. And this is intereconomics.org. U.S. tax dollars. So wait a second, let me get this straight. So the pharmaceutical industry that funds the research at the college, so they're funding the education, they're getting tax dollars given by the government. So our tax dollars from the government are paid to the pharmaceutical industry to produce the product that the government will buy and force distribute on our population, and making a huge profit for the pharmaceutical industry that they funnel back in to advertising, to the medical education, and to keep those the congressmen up there. And this is why when you ever see a congressional hearing, it's a religious meeting. Anytime you say anything against one of their products, they always say, well, before we talk about this, we got to understand, the product is safe and effective. It's really safe and effective, okay? Okay, I'm not going to bring up a lot of stuff because I am pro safe and effective, okay? It's like, Jesus, just say the words, okay? Research on drug expenditures from 1996 to 2013 shows that the increase was driven primarily by an increased utilization of drugs. Yeah, America, 5% of the world's population, we use 50% of the drugs. Okay, increased spending on pharmaceuticals reflects increased drug cost. Population growth has little to do with it. 35 pharmaceutical companies had a cumulative revenue 35 pharmaceutical companies at a cumulative revenue of $11.5 trillion. Okay, now FDA, yes, this is a regulatory agency designed to make sure that the products that are produced by the chemical industry, it used to be called the Chemistry Board, are safe. I'm not going to say safe and effective, are safe for the public. Okay, so, and this is propublica.org. FDA repays industry by rushing risky drugs to market. Wait a second. Risky drugs. I thought that they always had to go through the process of everything being safe and effective. Well, as pharma company underwrites 3/4 of the FDA's budget for scientific review, the agency is increasingly fast-tracking expensive drugs with significant side effects and unproven health benefits. And then they give a couple of examples. Nuplazid, okay. God, that sounds like you just threw up on your chest, okay? Drug for hallucinations and delusions associated with Parkinson's failed 2 clinical trials. A 3rd clinical trial under a revised standard for measuring its effects showed minimal benefits. Overall, more patients died and had serious effects after receiving no treatment. Aluric, I mean, we can go into Vioxx, killed more people than the Vietnam War. Aluric, a gout drug, more people suffered heart attacks, strokes, heart failure in 2 out of 3 trials than did their counterparts on standard no medications. Nevertheless, U.S. Food and Drug approved both of these drugs. Aluric's manufacturer reported last November that the patients were on the drug 34% more likely to die from heart disease than taking an alternative gout medication. 2016, well, it's 24,000 a year. There have been over 6,800 reports of adverse events. And figure, adverse drug events are now the 4th leading cause of death in America. And these are the right drug at the right time in the right dosage. This is criminal. The FDA is increasingly, now remember, 3/4 of the FDA's budget is governed by the industry, is funneled in there by the industry they're supposed to regulate. Greenlighting expensive drugs despite dangerous or little known side effects. Can you imagine, okay, rushing a product that's going to be given to people without proper safety analysis? Like, and I'm just talking off the hat, you know, a product that's going to be, I don't know if it's forced utilized or forced on the public. You know, maybe you got to take it to get food or clothing, shelter, or keep a job, okay, without appropriate safety testing. Mind-blowing. Now, Europe has also rejected drugs from the FDA, such as Futulin, okay, for a rare type of blood cancer. Now, and they cited insufficient evidence of health gains, which shrinks tumors but hasn't been shown to extend lives. And it only costs $92,000 for a 7-week course. Fact check, and I love this fact check from USA, because who funds the USA, CNN, the Oscars, who funds that? The pharmaceutical industry. Why? Because it's got to, you know, you got to get the information out there. Now, it's interesting when you look at this, because one group says 75% of the FDA's budget is from the industries that they're supposed to regulate. Fact check. Some, but not all, of the FDA's funding comes from the companies whose products it approves. About 45% of the FDA's $2.7 billion budget comes from industry user fees. The other 55% comes from federal funding. Okay, then you go down in the article and it says, for regulatory activities involving human drugs, it's about 65% of the budget. Okay, first it was 45, now it's 65. For biologics, and this is what they call vaccines, they call them biologics. Why? I wish I had 3 shells so I could show you why. Okay, because you're not going to really see the truth. Okay, biologics, it's around 40% of that. Really interesting. And I love this, newsletters out of the Atlantic, okay? Pharmaceutical ads give me hives. Now, we're one of 2 countries in the world that do DTC, direct-to-consumer advertisements. Ask your doctor if this is right for you, okay? Side effects may be, and then it goes on where the guy's talking super, super fast, and then they show you running through the field, you know, bleeding from your anus, and then you've got tuberculosis, and make sure you might be allergic to any of these ingredients, but you can run through this field too, okay? 1990s, the pharmaceutical industry got helpful clarification on TV rules for the FDA. In 1997, according to NPR, the drug companies spent $300 million on TV ads. A year later, it doubled $600 million. By 2000, it was $1.5 billion. Today, it's closer to $6 billion a year. American doctors are prescribing more drugs, even though it's not clear that these prescriptions are doing any good. Okay, 27 years of pharmaceutical industry, criminal and civil penalties. It's interesting, the industry that funds most of the TV, that funds most of the government, that pays the regulatory agencies that are supposed to be watching it, that also funds the education, so the doctors are graduating thinking, yeah, you got an ill, we got a pill. Okay, they're not looking at any other course, so it's a monologue. And then you hear the BS, like the science. No, science is always questioning. You know, if we had the same science of 100 years ago, oh my gosh, you know, you'd still be doing the heroin inside a cough syrup because it calms the child down. Don't look at me like that, it works. So they paid out $38.6 billion from 91 to 2017. However, that's only 5%. 95% of their profits were good. So this is a cost of doing business. You make $711 billion in net profits by the 11 largest drug companies. What's $38 billion, you know? But now the weird thing is, let's say you produce a drug, you swindle the Food and Drug Administration by giving them a bunch of money and then hiring their executives that were in the industry back into the industry. And this is the common. I mean, Julie Gerberding was head of the FDA for a while, or the CDC, and she went right into the industry, running the vaccine division. And criminal prosecutions of executives leading companies engaged in these illegal activities have been extremely rare. Yeah, no one's arrested. No one's arrested. Why? Because they pay the lawmakers. Now, types of pharmaceutical industry violations, okay? And when you look at this, overcharging, unlawful promotion, kickbacks, monopoly practices, concealing data. Concealing data. Wasn't there something about one of those drug companies that did some studies, and they said, look, you know, we're going to release the data on all our studies, but it'll only take like 75 years to release all the data. And the judge said, no, that sounds kind of shady to me. You know, you got to release it in the next few months. I'm not bringing up anything, you know, that I'm just thinking, you know. Poor manufacturing practices. No kidding. I thought they were made by angels. I thought if you make 1 million doses, that each one is going to be perfect. Okay. Financial violations, illegal distribution. Now, has any of this ever happened before? Yeah, this Tuskegee syphilis experiment. Okay, this is criminal. 40 years it went on where they're torturing these men only to see what the end stage of syphilis is when they had when they could help these people. I mean, in 97, and it started in 1932, Clinton issued a formal apology. Gee, we're really sorry we tortured all your relatives and killed them. And we didn't learn anything about it, but it was our protocol. Forced sterilization. Now, it's interesting. When was forced sterilization practiced in America? Okay, well, let's look at this. From the 1930s to the 1970s, nearly a third of women in Puerto Rico were coerced into sterilization. It was called La Operación. In Carolina in the 60s, up to 65% of all sterilizations of women which was 25% of the population. It was so common that it was known as the Mississippi appendectomy. Indian Health Services were sterilizing 25% of the indigenous women in the 60s and 70s. And this is from berkeley.edu. And this is the government. Okay, there is no oversight on this. There is no oversight with the regulatory capture. It's going to go crazy. This one here is going on right now. And this is children'shealthdefense.org. The House Select Subcommittee on Corona Pandemic on Tuesday presented the testimony of 4 public health experts described as government responses the worst public health mistakes in history. And by early 2020, about 95% of the Americans have contracted, okay, good, if I say it loud, you know, they might get me, despite the harsh countermeasures in most states. Widespread violations of civil liberties. Yeah, we did have a constitution that was really, really cool. It allowed freedom of speech and freedom of religion, except churches got to be closed, but liquor stores can be open. Anyone remember way back? I know. It's like, oh my God, that hurts my brain. I got to remember last year. Okay, Johns Hopkins did a meta-analysis that found out that lockdowns failed to contain the spread. Lockdowns harms schools, school closures, people not going to medical visits, has killed many Americans and will continue to do so over the next few years. How'd you like to have a 6-year-old kid that half his life he had to walk around like that? And this is brought to you by the guys that 6 out of 10 Americans have some type of chronic illness or disease. Okay, so this entire industry, okay, of giving you a drug for an ill, of having your doctor only prescribe, they're not prescribing deep sleep patterns. They're not prescribing healthy or exercise or any of this stuff, you know, because they're not paid for it. Mitochondria-induced, medication-induced mitochondrial damage. Mitochondria are the energy producers of the cells. If you damage the energy that your cells produce, you damage the protein production. And this is everything. This is how you keep alive. And if you take any medication, this will alter the mitochondrial production, okay? Analgesics, statin medications, acetaminophen, okay, that's Tylenol, and many others. What would this do if you alter the energy-producing structures inside of your cells? Schizophrenia, bipolar, Alzheimer's, headaches, migraines, stroke, Parkinson's, transient ischemic attacks, that's TIAs, cardiac myopathies, boy, that's getting popular, chronic fatigue, fibromyalgia. All of these things are the end result of your body not functioning correctly. I know what you're thinking. We have a drug for that. It's brand new, not really tested, but I think it's going to be popular. If you have healthy cell function, you have a healthy body. You got 70 trillion cells. So anything that negatively affects cells is bad for you. Anything that positively affects cells is good for you. Epigenetics. So that cell already has a genetic expression, but there's controls above the genes. Now, if you take any one of these types of drugs, and this is according to metabolism and clinical and experimental, and we're looking at blood pressure, cholesterol, analgesics, everything else. You alter your genetics, you get this. You get what America has. Heart disease, cancer, nerve and mental disorders, obesity, diabetes, bipolar disorder. This is an insane system that you're in. You're educated from little tiny children thinking that a poisonous chemical, that if you take too many of them, will kill you. And they have multiple side effects. And this is what you consider health care. Yes, you have joint pain. I'm going to give you a non-steroidal anti-inflammatory which destroys the building block of cartilage. You'll feel more comfortable while your joints rot, and 20% of all heart attacks come to it. I mean, this is absolutely, absolutely insane. Okay, now this is off the cdc.gov site. And I know what you're saying, safe and effective, except 66 vaccines have been discontinued. Okay, this is off the CDC website. So these are not made by angels. And I know it sounds odd that you think that one therapy for everyone's just going to be fine. Okay, We're all individuals. There's nothing that you could give to everyone and everyone will have the same response. Nothing. Vitamin C wouldn't work. Water wouldn't work. Okay? Not everyone is going to have the same response. To a sugar pill, it wouldn't work. Here's some more. Now, why were these brought in and why were they eliminated? Because they tried them on the public and they had more of a negative response to it. Okay? The right drug at the right time in the right dose. And this is old statistics. I'm pretty sure it's a heck of a lot more now because the adverse drug events, okay, is the 4th leading cause of death in America. Okay, 128,000 people. So what do? This is how we change it. If any politician, and you got to know they're in between a rock and a hard place, okay? They need money to run their program. Okay, and so we need a serious election reform. I mean, because if you're a congressman, you're going to have to go back and start your process of campaigning. If you're a senator, you're going to start your process of campaigning, and that takes millions of dollars. So we need campaign reform first. There is an intelligence in the body. Health is the natural state. All therapies must be in harmony with the body. Will stop until long-term independent research is completed. Long-term independent, that means just like the Federal Aeronautics Administration, that Boeing builds the plane. They're not going to approve it, okay? If there's a crash of a Boeing or Airbus or anything else, Boeing isn't going to investigate it. You're going to have a separate investigation to find out if it's safe. Okay, what was wrong, right? Shouldn't that be the same way for cars? Yes, it is. What about for any product you take inside? What about any product that's forced on you? Yes, I would like independent confirmation, and I don't want anything forced in me. Medical schools will no longer accept funding or research from the pharmaceutical industry. Oh my God. That means that they're going to start looking at health and instead of looking at what chemical you can give for a disease. Healthcare research will be independent. The pharmaceutical industry will be financially and morally responsible for their products. That would create a safe toaster. Okay, we need this. Okay, they're making, trillions and trillions and trillions of dollars. And it's time that they're responsible for their product. And any human being will be able to choose any healthcare process. Nothing will be forced on them. If anybody says, look, it's not my field, I just want to do whatever my doctor says. Okay, they watch CNN. It's okay. Love them, just use one-syllable words because they're not that smart. Okay, so we're going to change this world, okay? When we talk about these 5 keys to health, nerve supply, exercise, nutrition, rest, and prayer and meditation. It seems too simple, but it is. Now, we're going to get into some stuff. And this should make it by the censors because I've been really, really nice. I did say when I shouldn't have said it, okay? Now we're getting into the dangerous part. But those that are on Facebook and YouTube, God bless you. Share this rapidly because I really don't know how long it's going to be up there. And we've been shadow banned for forever, about 3.5 years now. So, click on the subscribe button, click on the bell, whatever you can do. Okay, and I download this one because I really don't know how long it's going to be on. Now we're getting